My name is Aidan Flynn and I'm a newly graduated speech and language therapist. So I've just finished the course and I'm currently doing a master's in dysphagia here at Trinity. And I'm here to talk to you about a degree in clinical speech and language studies. So it's a 4-year degree course and it gives you an in-depth understanding of communication and swallowing disorders. And it teaches you how to work as a speech and language therapist, helping people who may experience these difficulties. So just to clarify, it qualifies you as a speech and language therapist. And upon completion of the course, you're awarded with a Bachelor of Science in Clinical Speech and Language Studies. It's accredited by the Irish Association of Speech and Language Therapists. So looking firstly at communication, what does it mean? Well, it's a lot more than just words, so it's more than just speaking. It involves language, first of all, so that's both the understanding and use of language, so listening, reading, writing. It involves articulation and phonology, so that's the production of speech sounds. It involves the voice, so that's the sound produced by the vocal cords. Fluency, so it's not fluency in a second language, it's the flow and rhythm of speech. And if this is disrupted, it can manifest itself as a stammer or stutter. So maybe some of you have seen the King's Speech, so it refers to that. And then finally, non-verbal communication, so that's things like posture, facial expression, and signing. So clearly the ability to communicate is central to all that we do, to who we are, to how we learn, how we relate to each other. And communication difficulties can impact on people's ability to participate in education, social, economic, and career opportunities. So just looking at communication disorders, so this is when a person might have difficulty in the understanding or use of speech or language to relate to others in society. Then in recent years, dysphagia has been incorporated into our degree, so we're now qualified to work in dysphagia, and this is an eating, drinking, or swallowing disorder, and it can occur among all age groups, but it's common in older individuals, such as those who've had a stroke, and it can lead to further complications such as pneumonia. The speech and language therapist works as part of a team managing this. So turning now to the role of the speech and language therapist. We work with children and adults who have difficulties with language, communication, or swallowing. We assess, diagnose, and we aim to enable people to achieve their maximum potential to communicate and eat and drink without difficulty. And an important part of our role is working with the family and carers of our clients. So just some examples of what we do. We enable people who have experienced brain trauma, maybe as a result of a stroke or a road traffic accident, to regain functional communication, language, speech, and swallowing ability. Another example, we facilitate the development of speech and language skills of children and adolescents who may be experiencing difficulty. We help individuals use assistive systems of communication. Counselling is another core area, a core part of our role as a speech and language therapist. We counsel individuals and families so that they may better cope with family members' communication disorder. And we enable people who do not have speech to communicate through non-verbal means. So if you look at the picture there, there's a boy and he's possibly using an assistive device. So he might be able to speak, so he's using a device to communicate. So because communication disorders can occur at any age, we work with a variety of clients. So children with speech, language, voice, fluency, or communication impairments. And they might be associated with physical impairments such as cleft palate or cerebral palsy, intellectual impairments such as Down syndrome, oral or written language disorders, autism and Asperger's syndrome, emotional or behavioural disorders, and hearing impairments, and many other conditions. And then we also work with adults with speech, language, voice, fluency, and or communication impairments. So they might be associated with neurological disorders such as Parkinson's disease or Huntington's disease, stroke, dementia, cancer of the mouth and throat, intellectual disability, mental health problems, traumatic brain injury, and many other conditions. So who exactly do we work with? So as mentioned, we work with a client. It could be a child, adolescent, adult. We also work with a family, partner, or spouse. And a lot of our work is done within a multidisciplinary team. So that could consist of the doctor, the nurse, physiotherapist, occupational therapist, and so on. So it kind of depends on your setting. So in a hospital, you'd be working with physio, OT. Perhaps if you're working in a special school, you'd be liaising with teachers, principals, special needs assistants. So where does a speech and language therapist work? We can work in a variety of areas, such as a hospital, a rehabilitation centre, school, language unit, a nursing home, mental health centre. There's also a lot of scope for private practice, and sometimes we work in a client's home, so we do a lot of home visits for maybe people that can't leave their home. So there's lots of variety, as you can probably see, and so it varies from day to day and week to week. So it's something I love about the job. So just briefly looking at continued professional development. Speech and language therapy is a relatively young profession, so research and development in the profession is constantly bringing new techniques and new ideas and working with clients in order to provide the best quality service. So there are a variety of postgraduate courses available, and we're also encouraged as part of our work to engage in research. You can do an MSc in dysphagia, an MPhil in linguistics, or a PhD. And then opportunities for employment. So there are a continuing shortage of SLT posts. The HSE aren't really recruiting, but there are other means. Hospitals often don't go through the HSE route, so they hire apart from the HSE. Then SLTs are in great demand, so the waiting lists are still really long. However, they always have been in demand. So you can specialise, or you can work in a private capacity. It's also, the course is internationally accredited, so you can travel overseas, and there are opportunities, as previously mentioned, for further research and education. So just looking briefly at the entry requirements. Through your perspectives, I think last year the points were around 520. And then just looking at the theoretical component of the course, so it's done through lectures, tutorials and seminars, and a lot of our learning is done through problem-based learning. And this is group-based learning. It builds teamwork, and it's active and holistic learning rather than passive learning. So students split into groups and are given a problem, and you have to brainstorm as part of the group, set goals, collaborate, and then you come back with the acquired information and you present it to the rest of the group, and eventually you do a presentation for your class and for your lectures, which are marked on. And this reflects kind of clinical practice, so a client might come in to you in clinic and you mightn't have encountered their problem or their difficulty before, so kind of reflects the clinical practice. You have to go and brainstorm and solve the problem. So it's clinically relevant. And then the clinical component of the course, so this would be your placement. It allows students to transfer their theoretical knowledge in assessment and therapy with people with communication problems. So the aim is to have placements in a variety of settings, so you kind of get a taste for maybe working in a hospital, in a health centre, a special school, and with a variety of client groups. So children, adults, adolescents, with a variety of disorders. So you get a good idea of the different areas that you could work in. So just looking at the structure of the course, in first year, the focus is on typical development. Second year, assessment. Third year is intervention or therapy. And then fourth year is the overall management. So just taking a closer look at the first year. The theoretical component includes general and neuroanatomy, physiology, anatomy, linguistics, phonetics, speech and hearing, social and developmental psychology, and lifespan development. And then your clinical component is mainly observation in first year. So you might be visiting centres, and as part of the Connect programme, you meet people who may have communication difficulties, and you also have your audiology clinics. And senior freshmen or second years. The theoretical component includes disorders of communication. The focus is on assessment, so on the nature and assessment of speech, voice, fluency, language and communication disorders. Neuropsychology, lifespan development, linguistics. And in second year you have a broad curriculum option, so maybe if you did French or something in school and you'd like to keep it on, you have an option to study a course or a subject outside of speech and language therapy. And then the clinical component includes, it's focused on assessment of people with communication disorders. So you have placement in second year. Then third year, the focus is on intervention, and it includes disorders of communication, neurology, psychiatry, research methodology, and discourse analysis. And then in third year, you have longer placements, and the focus again is on the therapy or intervention. And you also have clinical workshops. So I think in third year, you have maybe 2 weeks placement before you start college. You have a day per week throughout the year, and then 2 weeks after. And the final year, the focus is on the overall management. The theoretical component includes disorders of communication and swallowing, counselling principles, ethics and administration, reflective studies, and you have your research project in final year, so that's your thesis. So it takes up quite a bit of your final year. And then the clinical component includes its clinical placements with a focus on the overall caseload management. So I think in final year, it's a 6-week block of placement after Christmas. So having outlined the job and the course, is this course for you? So if you have an interest in science and languages, you're a good listener, you've got social and interpersonal skills, you enjoy working with and helping people of all ages, and if you're a problem solver who likes to work both independently and as part of a team, then maybe you should consider speech and language therapy. So it's challenging, but it's a rewarding and satisfying job, definitely. And here are just a few useful links if you want more information about speech and language therapy. And that's the email address and phone number of the department here at Trinity. So if you have any questions, it's a bit of time. Okay, well, I think I'll leave it there. Thanks a million.